This is Dr. Pape, and today we're going to talk about patient education. The main purpose of patient education is to help patients and families increase their knowledge and their self-care abilities in order to improve and maintain health. This includes teaching them about their disease, treatments, and medications. Among other things, our objectives are to describe the teaching and learning process and factors that are assessed, strategies to improve health literacy and promote patient safety, and factors that influence adherence with therapy. We will be discussing the role of the nurse as coach in promoting behavior change and for evaluating learning, and the documentation of the teaching learning process, as well as how the nursing process can help patients solve problems. Patients look up to nurses as having knowledge and skills. They appreciate the nurses who help them with their healthcare behaviors, so our influence is huge. We are able to change health behavior for the better and have a positive impact on patients' health by teaching about disease prevention. Our effective teaching can lead to fewer hospitalizations, emergency department visits, as well as doctor's office visits. However, nurse-patient relationships must be interactive, and the education needs to be interactive. So, as you instruct on the topic, you will want to listen to the response of the patient or family. Take into account their physical abilities, their age, their mental ability, and their educational level. Not that you will ask them about their educational level, but you can make an educated guess from your previous conversations with the patient about their educational level. Still, your patient education plan should be in collaboration with the entire healthcare team. This would include physicians, dietitians, respiratory therapists, social workers, pharmacists, and so on. It will depend on the topic you are teaching as to whom you would seek advice from if needed. As nurses, we have an ethical responsibility to teach the patient and help them make informed decisions. We sometimes need to clarify the information that was taught by a physician. We must teach about medications, disease processes, self-care, care of dressings or braces, and any dressing change processes. Every interaction with your patient is an opportunity to teach. So begin teaching at the very first patient encounter. Listen to your patients, keep education patient-centered, and especially provide education that is culturally competent and considers language barriers. Identify the patient's strength and mention those as you go. This will help you and help the patient be encouraged. So just because you taught the information does not mean that learning took place. This is one reason we must evaluate that understanding took place. Use all appropriate sources of information to guide you in your teaching plan. If a family member can be present, identify the knowledge, skills, and attitudes that they will need as they help care for the patient. This may be just as important as reinforcing the teaching to the patient. Assess the patient's readiness to learn. Learning is a process by which a patient acquires or increases knowledge or changes behavior in a measurable way as a result of experience and learning. Learning is purposeful, remembering new information, attitudes, behaviors, and skills. Return demonstration of what was taught is important because of a skill such as insulin administration, which would be taught. A basic purpose of teaching, as I said before, is to help patients and families develop self-care behaviors. For example, a patient newly diagnosed with diabetes must acquire knowledge about diabetes as a disease process and the related medical management and self-care. They have to value health sufficiently to make certain lifestyle modifications, and they must master certain skills, such as medication administration of insulin. These are the three domains of learning: cognitive, affective, and psychomotor. The ability of patients to manage their daily life and maintain or resume their former roles depends on behavior changes. So effective teaching often involves the promotion of behaviors in all three of these domains. Cognitive learning involves the storing and recalling of new knowledge in the brain. For example, the patient describes how carbohydrates affect blood sugar. Learning in the affective domain may alter the patient's attitude about their health. For example, the patient might state how much better they felt after taking a walk down the hall. Learning in the psychomotor domain, such as a physical skill, involves mental and muscular acuity and activity. For example, the patient demonstrates how to change dressings using a clean technique. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. Minority populations often require culturally competent nurses who either speak their language or who are culturally competent. We as nurses must instruct these patients with care so they can make informed healthcare choices. They may be confused with certain medical language and have difficulty understanding English. They may struggle with filling out forms or have limited access to healthcare providers in their community. Healthcare professionals can identify the patient's specific health literacy level and make simple communication adjustments. Teach which internet sites are valid and reliable. Those would be ones that are from official healthcare sites. Teach the patient how to accurately measure medication doses. And when teaching skills such as insulin injection, allow additional time to teach to their level and use the teach-back technique. Populations who are underserved are likely to avoid medical screenings and visit the ER more often for care. So educate them and encourage them to get their medical screenings ahead of time. Definitely the scope of the problem is challenging, in part because healthcare information and directions are often written at the 10th grade level or higher. However, educational material is generally more easily understood when written at the 5th grade level. During teaching learning process, the teacher and the learner work together. The learner should have objectives that describe what the patient will or should be able to do after instruction. We have to be able to communicate in a simple language recognizable to the patient and not in highly medical terms. We have many different cultural and ethnic backgrounds to take care of today, so we need to seek information from a variety of sources. Once we identify the language deficits or barriers, we can develop strategies to address them and clearly communicate these in the nursing care plan. Do not assume that the family member is adequately translating information you may be teaching to the patient. We want the message to be stated clearly so that feedback occurs. Ask yourself, was there understanding or not? If not, why not? Always use positive reinforcements of learning when the patient restates accurate content. According to Knowles' learning theory, adults need to be taught differently than children. As people mature, their self-concept moves from dependence to independence. Adults' readiness to learn is often related to their social role. Most adults believe the information learned should be useful immediately. In general, adult learners must believe they need to learn the information before they are willing to learn it. Adults may need to be shown the importance of learning new information, health practices, or skills. When developing a teaching plan for older people, first identify any learning barriers or sensory losses, limited physical mobility, or inability to comply with the therapeutic regimen. Sensory deficits that can affect learning in older adults include the presence of cataracts, lighting, peripheral vision that requires teaching materials be kept immediately in front of the learner, or if they have a hearing loss. We have to take specific measures to help them with that. Successful teaching plans for older adults incorporate extra time, short-term teaching sessions, accommodation for sensory deficits, reducing environmental distractions, Older adults also benefit from instruction that relates new information to familiar activities or information. These are just a few of the suggested teaching strategies you might use. You might use lecture-type techniques, discussion, a panel discussion. In other words, if you have a group of people, we could get a panel together to help encourage interaction. You can use demonstration. This is always effective in the healthcare setting. You can use discovery, such as looking at the internet for valid information, role-playing, audiovisual materials such as videos, printed materials, pamphlets, and the like, and various programmed instruction materials, as well as offering web-based instruction and technology. So when we plan our teaching strategies and carry them out, we have to first prepare the physical environment with attention to comfort and privacy, gather all our materials, communicate effectively with the patient if it's an individual, small group, or a large group, deliver the content in an organized manner using selected teaching strategies. We have to remain flexible, keep the teaching sessions short, especially for patient teaching, vary strategies for sensory stimulation, relate the material to the patient's past life experiences. For example, ask them to share with you something that they have learned and explain that this is like how they learned that. Plan how you evaluate their learning and then assess the verbal and nonverbal feedback that you receive from the patient. So here are some key teaching plan basics to remember. You will want to select the content, assess the patient's current knowledge level of the topic being considered, because we may only need to build on what they already know. It's important to consider how you will go through the content and use appropriate strategies. Consider the patient's learning style. So find out how they learn best, whether visual, by hearing, by reading, by hands-on experience, or a combination. Discuss their interests and patterns of everyday living, as this conversation can give you an idea of how best to approach the topic. Identify the goals of learning, so what needs to be mastered for sure during this session. Pay careful attention to time constraints, scheduling, and the physical environment. So you may need to have a second teaching session because this is maybe not a good time. Decide on group versus individual teaching and whether you're going to use formal or informal session. So in evaluating whether learning took place, you can use a variety of ways. First, observe a return demonstration. Ask the patient to restate the instructions as they understand them. Ask the patient a few questions to determine whether additional teaching is needed. You may use a simple written test or questionnaire. Consult with the patient's family to determine their impression of the learning or to evaluate their understanding of what you have taught. Consider the patient's feedback and comments. Reinforce anything that seemed to be incorrect that the patient said, but always cheer the patient for the learning that did take place. Evaluate yourself and revise your content if the learner outcome is not met. You may need to present the information in a different way or reschedule the teaching session. And finally, document the teaching and learning process and the extent to which the patient demonstrated the skill or expressed understanding. If you document that the patient understood the instruction, also include a statement that the patient said and use quote marks around what was stated by the patient in your charting.